So we have Dr. Scott Moseman with us. He's with Laureate. He's one of the attending physicians with the Laureate Psychiatric Clinic and Hospital, and he works with pediatric patients. So I do want to preface the interview just making sure everybody understands that he's not going to be taking any political questions or any questions regarding the shooter and his potential state of mind. This is obviously just to try to help some of our local parents, kind of help guide them in the process of talking to their kids, and which can, of course, get a little bit complicated. Okay, so let's start it off, Dr. Moseman, by talking about, there are some guidelines, right, or some ground rules that you have, key ground rules for parents when talking about traumatic events.
Oh. So I would say, first of all, I think like other parents responding, I have 3 children at home. The youngest of my children is in elementary school. He's just finishing his 4th grade this week. So I think we all feel it very really about when things like this happen and how are things going to be safe. And so I think there is rules of like, how do I talk to my kids about things? So I have sort of five ground rules in which I like to look at and when talking to kids about traumatic events. The first is there's no right or wrong way in which to do things. So the ground rules are really about setting an environment in which you could meet the kid where they're at. So the first one is an open environment, that they allow them to ask questions. Don't try to start by telling them exactly what's going on, asking if they've heard about it, what they should do, what they've heard, what they think about it, et cetera. Trying to get and create an open environment for them to ask questions is important. It becomes important, number 2, is when they ask questions, it's pretty normal, especially at developmental age below 12, for kids to ask repetitive questions, right? And it is usually a developmental way in which they're seeking reassurance. So the types of questions they get repeated again and again can be important, and there might be things that specifically that child is worried about. It's important, I think, when you talk to kids to be really honest and open and real. I always say, as a child psychiatrist, age 2 to 22, like, kids know if you're being patronizing, kids know if you're keeping things from them. So I think within reasonable developmental appropriateness, being honest and real about what's going on and setting an environment in which you're talking about your own emotions, but trying not to let that dominate the conversation. The next thing that can be important to know when you're talking about kids is they will tend to personalize whatever information is. Their world exists in a very sort of small space of their own family, their own friends, their own school. And so it becomes, pretty normal for them to talk about, am I okay? Are my parents going to be okay? Is my friends at school okay? Are my teachers going to be okay? And that's really because their worlds don't really extend out very much. So it's hard to think sometimes about Texas or Connecticut or these other places, and it becomes a way in which they're trying to process things. The last and most important rule I like to talk about with kids, especially in emotionally charged situations like this, is balance. So I've always been a big Fred Rogers fan, a big Mr. Rogers fan. So I'm a big fan of looking at that balance of talking about in these situations, of looking for helpers, looking for people that are compassionate, looking for some good parts about the people trying to help the people that are struggling, as a way to balance out and not make this totally overwhelming, that their whole world is going away, that everything's bad, that this very difficult thing has happened and we're worried about these people, but also there's people that are there that are helping and trying to make these kiddos be okay over time. So those are sort of my ground rules about setting up a situation and looking at things.
Look for the helpers. That's good. I think it's hard to remember that in times like this. I wanted to mention for everybody, I have a couple questions I'm going to ask Dr. Moseman, and then we will, of course, open it up for anyone to ask anything that wasn't covered. So next, I guess, just to kind of help understand for anybody who isn't kind of struggling with this right now, why is it so difficult for parents? You mentioned not to let your own emotions take over the whole conversation. How do the parents' emotions affect how the kids absorb this information?
Well, I mean, I think in everything that we do as parents, it becomes very, very important that how we react to situations and how we deal things are absorbed directly by our kids, right? And so I think if you're too emotional or too unemotional about things, it's trying to find a balance in talking to yourself before you talk to your kids can be important. And about not imposing your own emotions on your kids. That's why that open environment of giving them a space to express themselves can be really important, right? And that I think we have to check our own emotions, how much we're watching the news, how much our kids might be watching the news with us, so that we still create a space. Kids still need a space in which they can feel safe and love, be safe and be loved. And so I think, again, not ignoring or not talking about the situation is probably not the right answer, but bringing it up, seeing when they're up, and keeping an open environment, but not dictating or keeping the course of things, trying to meet with a kid where they're at is really important.
You said ignoring it isn't the right way to deal with it. I've definitely seen people arguing about this online today. What if someone's child seems fine and hasn't mentioned it? Should you still start the conversation, especially if they're of the age where they know these things happen?
Right. I'm always sort of a big, somewhere in the middle kind of person, which is that I can tell you from my own kids. So last night, I have a 17-year-old, a 14-year-old, and, an 11-year-old. And so, very different conversations, but in different conversations, I'll ask, did you hear about the school shooting today? Do you have thoughts or questions or those kinds of things? And even for my own kids, because I have 3 kids and they're all different, the questions they come up with, what they want to talk about or not talk about, were different, right? But I would say if you have a kid and you bring it up and ask, and they're like, yep, I heard about it, and they just move on and they want to go ride their bike or do things, I don't think that you need to like sit them down and force them to do things or to look at things. By the same token, if you have a really, really sensitive kid, maybe a kid who's gone through trauma before, and if you find them pressed to the news and asking questions and getting upset, taking a step back, setting up and getting them in with their therapist, looking at seeing if their sensitivity to this subject is a sign of other anxiety or mental health issues they have, that can be important as well too. So for me, it's that balance. You still, I think you want to at least bring it up and let them know that there's a forum to talk about difficult topics in this family and with me as your parent. But again, some kids are going to want to talk a lot about it, and maybe you have to sort of like tamper down their anxiety or, the realistic nature of what's going to happen about it. And for, some kids, they're not going to be too concerned, and, not making them understand the importance of it or, talk about things, that's probably not helpful either. I think just having the conversation and them knowing that you're a safe place for them to talk about should things come up, and that no topic is off limits is just good parenting.
So you mentioned a child who's been through trauma, and I had that on my list. What if there is a child who's had any type of trauma? Does that affect how parents should approach this?
Yeah, I mean, I think you have to be, I sort of have a belief in my practice that, different children, all of us are wired with brains which have different stress sensitivities, right? And so I have kids who have different sensitivities about, my own children, about how they react to things. So, kids that experience trauma and get like post-traumatic stress or have had issues, they tend to have stress sensitive brains. And so sometimes viewing images on the news or talking about things can actually incite other trauma for them. And so sometimes with kids with previous trauma or kids that are very sensitive, I think you have to keep that in mind when you approach these topics. You might have to keep it in mind if they're, setting some boundaries, if they're insisting on watching the news and watching images that actually could make things worse for them. And that's why it's never a one size fits all. For some kids, you might have healthy conversations and watching the news together, especially at certain ages, might be appropriate. For some other kids, it might be that you need to sort of distract them away from things, and that these conversations and watching too much not be good for their mental health.
So as far as age, I'm assuming what parents should say varies greatly. We know, how greatly developmental phases vary from the youngest through, teenage years. So what about, the kids in pre-K and kindergarten age? They're going to school. They may know things like this happen already.
Right. Yes.
How much do you say to kids that are that young?
It's a good question. So, I would say, unless if you have a kid that's under school age, right? So let's say under kindergarten or so, I would say unless they're bringing it up or something's happening because they've heard it or seen then I don't know that bringing it up, that they even have the developmental understanding. I mean, I think an important thing to keep for me in mind is that for some kids until they're 6, 7, sometimes even 8, they don't even understand that death is permanent, right? So trying to enforce to them as a parent thinking about losing my own child. So you have all these people in this elementary school who have lost somebody so young. I think that our emotions get there, and recognizing that a kid who's under the age of 6 or 7 might not even understand what shooting and dying and what that really means for that kid. They might think, well, they got shot today in school and then next week they'll be back, or it'll be okay, or they'll bring them back, or other kinds of things have happened. So I think by the time, I have a just graduating 4th grader, by the time they're in elementary school, this happened to elementary school kids, saying something happened in your school. Fortunately or unfortunately nowadays, I don't think there's any school teacher or administrator at elementary school or above that's not having to have conversations with children, school shooting drills and those kinds of things. So it's not like if you're sheltering your kid from talking about this, that they're not hearing about it. I think you just want to make sure that they're hearing about it at home too, and that home and parents are a safe place for that to happen. Now, my talk with my teenagers did go into talking about, well, what do you think about policy? What are actions? What things can you do or not do about this as you become an adult, as you're deciding on your career? So those conversations can look very different, whether it don't even matter political spectrum, whether it's about gun rights, whether it's about safety, whether it's about other kinds of things. Developmentally appropriate conversations are good, but knowing that home is a safe place to have those conversations is good at any age.
Okay. And you had mentioned some kids may be okay watching the news with you. Is there any amount that's too much? I mean, should you be aware how much is too much, if that's such a thing?
Yeah, I think there's some good studies to show that kids watching too much news about traumatic situations is probably just not helpful for them. And truthfully, for me, it will be somewhat of a worrisome sign, right? Because for most kids, their worlds revolve around, TikTok and their friends and other kinds of things. And so, them actually getting on and watching the news repetitively is probably not good, and actually might be a sign, if they're doing that they're trying to process something and work on something. And so if they're watching the news or want to watch the news too much, it might open up a conversation of, what's your curiosity about this? Are you worried about this? Is there something specific that you're worried about in watching this? It could be a sign that there's something else you need to check out.
Okay. And so we do have questions from Betty Casey from Tulsa Kids. She wants to know, how do parents manage their own anxieties, their own emotions, and anxiety as they talk to the kids? And I know she's having trouble hearing us, so I know that you talked about that a little bit, but I guess while you're in the moment and it's fresh, I would not have been able to have that conversation with my kids yesterday, because I couldn't have done it without probably affecting them terribly. So, but when you do eventually, how do you manage that? Because I think that could probably be really hard for some people.
Right. Well, I mean, parents are examples of parents to kids is that emotions and anger and all these things are a normal part of human experience. And part of kids getting older is recognizing that your parents are people, that you make mistakes and that things happen. And so I absolutely don't think about having some emotion in talking about things that make you sad or angry is bad. Again, that rule I had about being honest and real is also being honest and real about your own emotions. You know, we talk about, you know, maybe when it's too much, or you worry that if you have an anxious kid, that, you know, news like this can spur their anxiety. I think the same thing as parents, like we have to check with ourselves, right? So if you're a parent with a stress or anxiety disorder, and this really has you spinning and off, right? Then, you know, having too much anxiety or exposing too much and talking to them a lot because you're processing your own things could have influence on them. It's kind of that experiment they have, right? Where you have the mom and you have the baby and you have like the glass across the unknown space, right? And if the mother doesn't look too worried and looks like they can do stuff, the baby feels confident to crawl across. If the mom is very, very upset, the baby gets upset themselves. For me, it's all about balance. So these are situations which bring up anger and normal emotions, and them understanding that you have emotions about that is okay. If the emotions are so overwhelming that you can't communicate, or you can't leave room as well for your child to have room in the space for their own emotions, then, you know, you seek out your own mental health care for how that works, how that goes. There might be situations where mom is the better one to talk about it and can do stuff. There might be ones where dad's the better one to talk about it and do it. And I think that's sort of how families work. And for me, it's about balance. So being honest and real is good. If your own anxiety is so overwhelming that it's hard to listen or be present with your kid, then taking care of yourself and finding other ways to talk about it could be helpful.
Okay. Betty had one more question. You mentioned noticing if they're kind of obsessively watching news or reading about it. Are there any other signs that parents can look for that their kids are struggling with something like this?
Absolutely. So great question. So when you bring up anxiety for kids, right, I think something enters my office when it stops kids from doing normal kid things. So kids should be able to sleep normally. They should be able to eat normally. They should be able to go to school, have friends, not have panic attacks, not be overly obsessive and stuck on any one subject. So if you start to see them functioning in a different way, right? They're not sleeping, they're getting up, they're having nightmares, they're refusing to go to school or having panic attacks, or especially with younger kids, symptoms will come out somatically. So chronic stomach aches or headaches. These are ways in which kids are telling us they're stressed and their stress level's too high. And so if you're seeing that interfere over a prolonged period for more than a day or two, then that's a good time to reach out for professional help. Seek out your pediatrician, psychiatrist, therapist, somebody that can help and treat for anxiety disorders, because it could be a stage that this is getting in the way and causing problems for them.
Okay. So we're open for other questions. Betty put hers in the chat and you can do that. Otherwise, you can also unmute and ask if you'd like to.
You may have addressed this, but if your kids do not bring it up, should you bring it up, and how should you do that?
I think the simple thing, because again, I think the thing is there's no right or wrong way to talk to kids about it. I think if you're overly wanting to talk about it all the time, or you don't want to mention it all to them, those might be some worries that are on the parent side. To my own kids, I really just ask them, you know, did you hear about the school shooting that happened today? Do you have any questions? My older two, social media or whatever, had heard and were wanting to have conversations about policy and other kinds of things that might come up. My younger kid hasn't. I asked him about it. He's sort of my sensitive one or whatever else. And he had some questions about stuff. He had some questions about his own school and those kinds of things. And it went by. Now with my younger kid, if he would have said, yeah, I've heard about it. That sucks. I hope the kids are okay, or whatever else. And then he's like, can I go kick my soccer ball now? I'd be like, yeah, let me come out with you and go do that. So I think you really have to meet them where they're at. So, you know, trying to have an agenda about how they're supposed to react, or, you know, even how they're supposed to react, like they're supposed to be as overwhelmed about you. I mean, what we have to realize, unfortunately, is that we have a generation of kids that are growing up with this being relatively common news for them. And so as they hear it again and again, there can be some desensitization to it. They've heard it, they haven't personally experienced it. And so they might not have questions and move on. And that's okay too. You've still set the environment that should you want to talk about this, I'm somebody you can talk to about it. And this is a safe space to talk about that.
I have one quick one. Thanks for doing this, by the way.
Sure.
What happens if, a kid, maybe fourth grade, elementary school age, what if they say they don't want to go to school and you are a parent and you are having to talk with them about this and they're just too scared to go? Is that a time to seek professional help? Is there a way that a parent can talk to a kid about that?
Well, some of it becomes, trust me, post-pandemic, in pandemic, end of the pandemic, life has never been busier in the mental health field, right? So I have 3 kids in school. It's May, I'm tired, right? Kids are tired, kids are overwhelmed. So what I would say is one day of, I don't want to go to school, I'm not going to school, let's talk about it. If that becomes a pattern for them, my child psychiatrist thing becomes school avoidance is not a good thing. Getting kids to school, making sure they're not avoiding school is, every textbook says, don't let them avoid school because that might elicit a pattern that school's not safe and you're not supposed to be there and things aren't supposed to work. But having one day of not wanting to go to school, I'm overwhelmed, it's the end of school, this is a lot of news, is probably in itself not enough. But if it becomes more of a pattern, again, if it doesn't resolve in a day or two, that starts to become, well, maybe I have a kid who is anxious and whose brain is stress sensitive, and maybe there are solutions, therapy and otherwise, to sort of help them with that the same way you'd help them with any other medical condition.
We have the Tulsa World.
CO, Dr. Moseman, thank you for making yourself available.
Sure.
You mentioned, a moment ago, and I hate that you had to say it, but it's fair, there's some truth to it, that this generation of kids is growing up with this being somewhat common for them, and they haven't necessarily experienced it personally. However, we did have a TPS site that had to go on lockdown today.
Sure.
Because of a threat that was called in. And granted, it was deemed not credible,
Yep.
Thankfully, but would you give any additional advice to parents from that community or who have kids who go to that school? Because Tulsa's a small town. Everybody talks about, okay, do you have any additional advice for parents in dealing with that? Since, as you mentioned, kids tend to personalize things, and that's
Sure.
pretty personal after what happened yesterday.
And the true and unfortunate thing that tends to happen, whether it's teenage suicide or whether it is shootings, bombs, drugs, other kinds of things, is that it is not uncommon when these things pervade media and social media for them to be copycats and things that happen. That becomes unfortunate sort of ripples and waves, what happens from traumatic events. These things can sort of, run their course and happen in different situations. So I had not heard about the TPS thing today, but it does not surprise me when it's point of mind and those kinds of things happen that it comes up. I still think the best option when I'm talking to parents around how do you create a home environment in which your kids feel safe to talk about things and to process emotions, is keeping things open and continuing to talk about things. I did not have school shooting drills. I remember tornado drills. Maybe if you go back further, people had nuclear bomb testing drills. These things sort of happen. I think we're more sensitive to the fact nowadays that kids are listening and this does impact them. I think they're understanding that they're giving incredible high levels in which they're expected to achieve in so many ways. And yet at the same time being told that the world is an incredibly unsafe place does always keep me in business as a child psychiatrist, right? So the environments that we create for kids where there's high expectations and a degree of talk and exposure to the lack of safety does make it a more difficult environment for children to grow up in. And so my advice that I try to do with my own kids is just keep an environment where they do realize that they are safe at home, that home's a safe place to talk about these things, and that all emotions are valid and all opinions are valid in the household. That's part of what makes them become emotionally balanced and responsible adults.
Dr. Moseman, I have another question, and again, I apologize if this is something you've brought up.
Sure, no worries.
This is great, by the way. I remember with Sandy Hook, one of the suggestions was helping children have some power over, or feeling of control over their emotions, or being able to help, I guess.
Sure.
And one of those things was maybe writing cards to the community, or I mean, is that something that would be a good suggestion? Are there other ways that we could make children feel that they have a little control?
Yeah, I think that's an excellent question. Actually, the relatively sad thing that I had to do in preparing for this interview, I'm a member of the American Academy of Adolescent Psychiatry. David Fassler, who's out of University of Vermont, had written a set of talking points after the Sandy Hook shootings about how to talk to kids. And so unfortunate that those references that I can pretty quickly go to make sure that I'm, not missing anything. What I would say is that I take a lot of my lead from where the individual child is at, right? And that notion of us as parents not enforcing our emotions of what we think need to happen onto our kids is important. So I would certainly say, if I have a child who's saying, is there anything I can do? An empathetic child, is there anything I could do, any way that I can support or do things? That there are, lots of things. There's ways to fundraise. There is ways to become politically involved if you feel like that's a notion within an age developmental appropriate region, or to be as simple as to, writing a card to families. If they're older, it can be writing cards to senators and other kinds of people. Yeah, I mean, some ways that, I think other good parenting is having them involved in the process. I think any ways in which we can enhance and adapt our kids to be empathetic is just good parenting, of how they're feeling and what it must be like to be in somebody else's shoes, and what we can do to be helpful for them. Seeing examples of how other people are being helpful. There are learning experiences beyond the terrors of the world that happen from traumatic events.
Dr. Moseman, is there anything else that you want to add that none of us asked about?
No, I mean, I think my biggest sentiment as a parent that I saw on social media is this idea of, we get really busy in the day in and day out things of life, in, baseball and soccer tryouts and grades and those kinds of things that happen in May at the end of school. It becomes sort of lifelong, and just taking out time, hugging your kids, talking to your kids, being at home with your kids, spending quality time with your kids, take them fishing, take them out, going on a hike, doing things like that becomes, I think, especially important when you recognize events like this happen. Taking a break from the hustle and bustle, from the difficulties and traumas of life, and being together as a family is a really good way to deal with difficulties, to deal with things after we've all just witnessed and been part of a 2-year trauma of surviving a pandemic and kids and school and home. Trying to keep it simple, trying to remember your core family and core values, I think is always good at times like these.